Respiratory diseases. These are the common infectious diseases in respiratory tract. Common cold, influenza, pneumonia, and tuberculosis.
Common cold is a contagious infection. Can be spread from one person to another by direct or indirect contact in the upper respiratory tract. It is a result of viral infection.
Influenza or flu is a contagious illness still, which means it can be passed from one person to another caused by influenza viruses. Common cold may result to flu if not treated immediately. It may also lead to pneumonia. Pneumonia is an infection in both lungs. It is caused by bacteria, viruses, or fungi. It causes inflammation in the lungs, specifically in alveoli, which becomes filled with fluid. Adults are at a common risks. Tuberculosis or TB is a disease caused by Mycobacterium tuberculosis. This bacteria attacks the lungs, but it can also cause damage to other parts of the body. It spreads to the air when a person is talking, coughs, or sneezes. Another respiratory diseases are emphysema, asthma, bronchitis, and lung cancer. Asthma is a chronic disease or conditions that last for 1 or more years, or for a long time that requires an ongoing medication. It makes breathing airways narrow and swollen, causing them to produce extra mucose. People with asthma experience breathing difficulty, wheezing while inhaling or exhaling. Wheezing is a whistling sound in the chest. Inhalation of pollen, dust, and dead cells triggers asthma. It cannot be cured, but it can be controlled by using asthma inhaler. Bronchitis is an inflammation or swelling of bronchial tube. It is caused by viral infection and can be triggered by industrial pollutants and smoke. It lasts for a long time and leads to scarring of bronchial tube. It can be treated by sufficient rest and drinking enough fluid. But as what they say, if symptoms persist, consult your doctor. Emphysema is a long-term disease of lungs caused by prolonged exposures to respiratory irritant like smokes from industrial pollutants, tobacco, and more. It damages the alveoli, as well as the breathing passages. Incurable and no treatment available. Medications such as antibiotics can stop infections. Lung cancer is a long-term exposure to tobacco. Malignant lung tumor characterized by uncontrolled cell growth in tissue of the lungs caused by carcinogenic chemicals. Treatments are removal of damaged part, chemotherapy, and radiation.